1. A patient taking linezolid for MRSA reports a pounding headache after eating aged cheese. What is the nurse's priority action? Answer: assess blood pressure and notify the provider immediately. Rationale: linezolid has MAOI properties and can interact with tyramine-rich foods, causing a hypertensive crisis. 2. A nurse is caring for a patient on methotrexate who reports fatigue and pallor. What is the nurse's best response? Answer: assess complete blood count for anemia and bone marrow suppression. Rationale: methotrexate can cause myelosuppression, leading to anemia, leukopenia, and thrombocytopenia. 3. A patient on lamivudine for hepatitis B reports fatigue and abdominal pain. What should the nurse do first? Answer: assess liver enzymes and monitor for signs of hepatotoxicity. Rationale: antiviral drugs like lamivudine may cause liver dysfunction. Early recognition prevents complications. 4. A nurse is preparing to administer cisplatin to a cancer patient. What is the most important pre-administration assessment? Answer: review renal function labs such as creatinine and BUN. Rationale: cisplatin is nephrotoxic, and renal function must be assessed to avoid kidney damage. 5. A patient receiving vancomycin reports ringing in the ears. What is the nurse's immediate concern? Answer: ototoxicity. Hold the dose and notify the provider. Rationale: vancomycin can cause permanent hearing loss. Tinnitus may be an early warning sign. 6. A patient taking verapamil for hypertension develops swollen ankles. What is the appropriate nursing intervention? Answer: educate the patient that peripheral edema is a common side effect and monitor. Rationale: calcium channel blockers like verapamil can cause vasodilation-related edema. It is usually not harmful, but should be monitored. 7. A nurse is caring for a patient on sulfonylureas who is diaphoretic, shaky, and confused. What should the nurse do first? Answer: check the patient's blood glucose level. Rationale: sulfonylureas increase insulin secretion, raising the risk of hypoglycemia. Symptoms suggest low glucose. 8. A patient taking alendronate reports difficulty swallowing and chest discomfort. What is the nurse's next action? Answer: instruct the patient to stop taking the medication and notify the provider. Rationale: these symptoms suggest esophageal irritation or ulceration, a known side effect of bisphosphonates. 9. A nurse administers promethazine 4, and the patient reports burning at the injection site. What is the nurse's immediate action? Answer: stop the infusion and assess for tissue injury. Rationale: promethazine is a vesicant and can cause severe tissue damage if extravasation occurs. 10. A patient on isotretinoin reports persistent mood swings and thoughts of self-harm. What is the nurse's priority action? Answer: discontinue the medication and notify the provider immediately. Rationale: isotretinoin is linked to depression and suicidal ideation and must be discontinued if these symptoms arise. 11. A patient taking levetiracetam for seizures becomes agitated and irritable. What is the appropriate nursing action? Answer: monitor for neuropsychiatric side effects and notify the provider. Rationale: levetiracetam can cause behavioral changes including agitation, anxiety, and depression. 12. A nurse is administering for acyclovir. What is the most important precaution? Answer: ensure slow infusion over at least 1 hour to reduce nephrotoxicity. Rationale: acyclovir can crystallize in renal tubules if infused too quickly, leading to kidney damage. 13. A patient receiving chlorothiazide reports muscle cramps and palpitations. What should the nurse assess? Answer: serum potassium and magnesium levels. Rationale: thiazide diuretics cause electrolyte loss, especially potassium and magnesium, leading to cramps and arrhythmias. 14. A nurse is reviewing medications for a pregnant patient. Which drug requires immediate discontinuation? Answer: warfarin. Rationale: warfarin is teratogenic and should be replaced with heparin during pregnancy. 15. A patient with a new prescription for phenytoin develops a rash. What is the nurse's immediate action? Answer: hold the medication and notify the provider. Rationale: rash may be an early sign of Stevens-Johnson syndrome, which is life-threatening. 16. A patient taking sumatriptan for migraines reports chest pressure. What should the nurse do? Answer: stop the medication and assess cardiac status. Rationale: sumatriptan can cause coronary vasospasm, mimicking angina or leading to myocardial infarction. 17. A nurse is caring for a patient taking fluconazole. What side effect requires priority assessment? Answer: hepatotoxicity indicated by right upper quadrant pain or jaundice. Rationale: fluconazole is metabolized by the liver and can cause liver damage. 18. A patient on infliximab therapy develops a low-grade fever and cough. What should the nurse do? Answer: notify the provider and assess for signs of latent tuberculosis activation. Rationale: infliximab suppresses the immune system and can reactivate TB. Screening and monitoring are crucial. 19. A patient receiving propranolol reports shortness of breath and wheezing. What is the nurse's priority? Answer: assess for bronchospasm and withhold further doses. Rationale: non-selective beta blockers like propranolol can cause bronchospasm, especially in patients with respiratory conditions. 20. A nurse is caring for a patient taking terazosin. What teaching is most important for this patient? Answer: rise slowly from sitting or lying positions to avoid dizziness. Rationale: terazosin can cause orthostatic hypotension, especially after the first dose, increasing fall risk. 21. A patient taking hydralazine develops joint pain and a butterfly-shaped rash on the face. What is the nurse's priority action? Answer: notify the provider and evaluate for drug-induced lupus. Rationale: hydralazine can cause lupus-like syndrome. The symptoms warrant discontinuation and further evaluation. 22. A patient on clozapine reports fever and sore throat. What should the nurse do first? Answer: check white blood cell count immediately. Rationale: clozapine can cause agranulocytosis, a potentially fatal drop in white blood cells. 23. A patient receiving haloperidol becomes rigid and febrile. What is the nurse's first priority? Answer: discontinue the drug and assess for neuroleptic malignant syndrome. Rationale: these are classic signs of neuroleptic malignant syndrome, a life-threatening reaction to antipsychotics. 24. A patient is receiving cyclosporin post-transplant. What is the most important side effect to monitor for? Answer: signs of infection such as fever or sore throat. Rationale: cyclosporin suppresses the immune system, increasing infection risk. 25. A nurse is reviewing the medication list of a patient on spironolactone. Which lab value needs monitoring? Answer: serum potassium level. Rationale: spironolactone is a potassium-sparing diuretic and can cause hyperkalemia. 26. A patient taking carbamazepine develops facial swelling and a widespread rash. What is the nurse's next step? Answer: discontinue the medication and notify the provider. Rationale: these symptoms may indicate Stevens-Johnson syndrome or angioedema, requiring emergency action. 27. A nurse is administering 4 potassium chloride. What safety precaution is essential? Answer: ensure it is diluted and infused slowly using a pump. Rationale: rapid 4-potassium can cause cardiac arrest. It must always be infused at a controlled rate. 28. A patient taking levothyroxine reports feeling nervous and having palpitations. What should the nurse assess first? Answer: check for signs of thyrotoxicosis. Rationale: these are symptoms of excessive thyroid hormone, suggesting overmedication. 29. A patient on metoprolol complains of fatigue and dizziness. What is the nurse's first response? Answer: assess blood pressure and heart rate. Rationale: metoprolol lowers both heart rate and blood pressure. Excessive reduction can cause these symptoms. 30. A nurse is teaching a patient about nitroglycerin patches. Which instruction is essential? Answer: remove the patch at night to reduce tolerance. Rationale: A nitrate-free interval prevents tolerance to the vasodilating effects of nitroglycerin. 31. A patient receiving valproic acid reports nausea and jaundice. What is the nurse's priority? Answer: evaluate liver function tests. Rationale: valproic acid can cause hepatotoxicity, especially in children and the elderly. 32. A patient is receiving captopril for hypertension. What side effect requires immediate attention? Answer: swelling of the lips and tongue. Rationale: angioedema is a potentially life-threatening adverse effect of ACE inhibitors. 33. A patient taking colchicine for gout reports severe diarrhea. What should the nurse do? Answer: hold the medication and notify the provider. Rationale: gastrointestinal toxicity is a dose-limiting side effect of colchicine. 34. A nurse prepares to give an opioid for pain. What should be assessed before administration? Answer: respiratory rate and level of consciousness. Rationale: opioids can depress respiratory function and mental alertness. 35. A patient taking statins reports muscle aches and weakness. What is the nurse's first action? Answer: assess creatine kinase levels. Rationale: statins can cause rhabdomyolysis, a serious condition involving muscle breakdown. 36. A patient on tamoxifen for breast cancer prevention reports leg swelling and pain. What is the nurse's priority? Answer: assess for signs of deep vein thrombosis. Rationale: tamoxifen increases the risk of thromboembolic events like DVT. 37. A nurse is caring for a patient receiving forfenitoin. What complication should be avoided during administration? Answer: bradycardia and hypotension from rapid infusion. Rationale: phenytoin must be given slowly to prevent cardiovascular collapse. 38. A patient receiving neostigmine for myasthenia gravis develops increased salivation and diarrhea. What is the nurse's next step? Answer: assess for cholinergic crisis and hold the drug. Rationale: these are symptoms of excessive cholinergic stimulation, requiring prompt intervention. 39. A nurse is educating a patient on rifabutin. What key side effect must be included in the teaching? Answer: report any visual changes immediately. Rationale: rifabutin can cause uveitis and vision problems, requiring ophthalmologic evaluation. 40. A patient is prescribed tetracycline. What instruction should the nurse emphasize? Answer: avoid taking with dairy products or antacids. Rationale: tetracycline binds with calcium and magnesium, impairing absorption and effectiveness. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!